DailyClout. I'm here today with Professor Retsef Levi. Professor Levi is an expert at analytics, safety, and risk management at MIT with extensive experience in biological drug manufacturing. Professor Levi, thank you so much for being here with us today. I have a lot of questions for you, so thank you and welcome to the program.
Thank you very much for having me, and I look forward for the discussion.
Thank you. I'd like to start with the research that you did, that you showed recently about the Israel National EMS data.
So this is work we've been doing actually quite some time ago. I think, what we were motivated by is what we knew clinically about the impact of both COVID-19 infections and COVID-19 vaccines in terms of adverse cardiovascular outcomes especially among young individuals, and specifically the known clinical mechanisms that they can cause myocarditis, inflammation of the heart among young people. And what we know about myocarditis that it can be quite hard to diagnose and can have a lot of subclinical presentations or vague presentations, and that it's often a cause of sudden death or cardiac arrest death among young people. And given that, we thought that analyzing the EMS data in Israel, which in Israel we are fortunate to have a centralized EMS service, would potentially give us an indication if there is some signal about increased out-of-hospital death or adverse outcomes during different periods throughout the last 2 years. So our study actually covered a period of time from 2019 in which we didn't have COVID-19 infections at all, and we didn't have vaccines. Then throughout 2021, from March 2020, throughout 2020, from March 2020 to throughout the end of 2020, this is a period of time where we have COVID-19 infections and no vaccines. And then the first half of 2021 were parallel to the third wave of the COVID-19 infections. We had essentially Israel launched its mass vaccination campaign. And when we actually looked on the data, what we saw is that when you look on the EMS calls with cardiac arrest diagnosis, namely that people, these are diagnoses that were done by the EMS teams, field teams, retrospectively after they saw the patient. And we looked on these calls among ages 16 to 39. We see in 2021, the first half of 2021, an increase of 25% in these calls. Now, when you go further and you try to analyze the temporal correlation of these calls with both the COVID-19 infections as well as the number of doses given to this age group, you actually detect that there is a temporal correlation between the number of vaccine doses and the EMS calls, and such correlation with the COVID-19 infections is not detected. Now, this is clearly, and it's very important to understand that this is clearly by itself not a proof of causality, but given the known clinical causal mechanisms between vaccines and myocarditis and between myocarditis and cardiac arrest, this is something that is definitely calls for immediate investigation that will look into the vaccine as a potential cause, but also potentially other causes, and try to explain why do we see such a major increase in cardiac arrest calls among people that are not supposed to have very frequent events like that, again, ages 16 to 39. And of course, this kind of investigation should bring about a lot of additional data about the vaccination status and the infection status of the individuals that are being affected. But unfortunately, the Ministry of Health essentially dismissed this call. The Ministry of Health in Israel dismissed this call and basically claimed that, effectively speaking, they claimed that the Israeli EMS diagnoses are questionable and that they don't know how to diagnose. This is very, very unfortunate because in most of these cases, people are being resuscitated. So it's hard to see how the EMS teams will get this wrong. Anyhow, unfortunately, we're still waiting for the Ministry of Health to conduct a serious investigation about that. And this is, looking kind of this we're talking about now, end of 21, early 2022, when the paper came out. Since then, there is actually mounting evidence, including similar data from other countries, but also prospective studies that were done on people that got vaccinated before and after they got vaccinated that show that the rates of individuals that are being affected with potential heart damage is really high. I mean, it's two studies from Thailand and Switzerland show maybe a rate of 1 in 50, 1 in 30. And also other studies that are based on autopsies of people that passed away shortly after being vaccinated that show that the scenario that people get vaccinated have a myocarditis induced by the vaccine, and then as a result, a cardiac arrest and sudden death. This is not a theoretical scenario. This is happening, and all of this mounting evidence together with population level data like I just described, but other population level data like the excess mortality that we see in many countries, and the increase of disabilities that we see in many countries. These are all very, very concerning to the extent that I think at this point, ignoring these signals and just continuing to recommend people to get vaccinated is just irresponsible, and we really have to stop the vaccination campaigns and really make sure that we understand what is going on.
Okay, so I understand. Thank you so much for that. I saw a video that circulated a while ago of you calling for a complete halt to the mRNA vaccinations. You're also a part of an organization here in Israel called HALT, which advocates for medical freedom and has done a lot of advocacy regarding the COVID-19 response here in Israel. What does the Ministry of Health respond to you when you turn to them with all of your concerns?
Yeah. So I'm honored to be part of this very prestigious group of people. Very experienced medical doctors, people that have played or have had roles, major roles in the Israeli health systems, running healthcare maintenance organizations, running being in many other senior positions in the healthcare systems in the US, and also major scientists that all came together several years ago. With very different views than the narrative that governed the Israeli COVID-19 policies. It started with basically this group of people opposing to the lockdown policies, and continued with this group basically presenting a much more balanced approach that was also against the mandates of vaccines. And we basically came to this debate with a very constructive approach, in the sense that we felt that when the government is making decisions, the government should actually consult with a broad set of views to be able to integrate the different scientific and medical views and clinical views to be able to formulate balanced policies. Unfortunately, the Ministry of Health refused to listen to any other opinions that did not match the narrative. And the narrative started with first lockdowns is the only thing that can save us. And then after that, vaccination is the only thing that can save us. And I think that this is very unfortunate that the Ministry of Health continues to ignore this group of people and essentially continues to run a very one-sided narrative that doesn't give any space to any dissenting opinion. And in fact, it's not just not listening. It's in fact, in many cases, some of my colleagues in this group were attacked on social media and in other channels just because they dared to express opinions that are different, that were different than the narrative. And as time progresses, I think looking retrospectively, I can proudly say that almost all the positions that this group expressed throughout the last almost 3 years have turned out to be just the truth and just based on the fact. So, we now know that the lockdowns were a disaster. They did not stop the spread of the virus, and they caused generational damage to children and young people, not to mention major damage to the economy that people don't speak about enough today. And then we know now that the mandates that were imposed and the green passport policies in Israel that were imposed based on the false premise that these vaccines can stop infections and transmission, can stop the spread of the virus. We know that this paradigm collapsed. This was never actually tested or never had any proof, but nevertheless was communicated again and again to the public. We all remember in Israel, you have to vaccinate to save grandma. I think that we know now that this was basically fake news. And now I think maybe the most disturbing issue is the really the lack of empathy and the suppression of any discussion about the vaccine injuries, and really continuing to push and recommend these vaccines to pregnant women, to children, to young people. This is just really very, very unfortunate. And I think when you look on the public reaction to the policies of the Ministry of Health in Israel, I think that they speak for themselves. And let me just clarify. People maybe don't know, but in Israel, for traditional vaccines, we used to have a 98% adherence with no mandates. Essentially, the Israeli public believed the Ministry of Health and followed all the recommended traditional vaccines.
That's a very high rate.
Yeah, that's a very high rate, like 98. Now, when you look on the adherence to the first 2 doses of the mRNA COVID-19 vaccines, you see like also a very, very high rate of adherence. I think in the entire population is close to 80%, and in the older ages, this is really high 90s, right? Then comes about the booster, the third booster. There you already see adherence of less than 50%, and the fourth booster you see about 20-something%. And when we talk about the fifth booster and the vaccination of children, you essentially see that the Israeli public votes by its feet and just basically doesn't comply with the recommendations. And I think one has to ask oneself, what does this reflect? And in my mind, this reflects a complete mistrust in what the Ministry of Health in Israel is communicating. And also, to be honest, and this is kind of supported also by surveys that the Ministry of Health did, I think people definitely they know that this vaccine is not protecting you from getting infected. Everybody got infected, vaccinated or unvaccinated.
Over and over.
They also know many people close to them, friends, family, and maybe themselves, that were injured by this vaccine at one level or another. And I think that people just vote by their feet, and they just don't comply. But that doesn't take away it doesn't solve the problem that we need to acknowledge the fact that there are vaccine injuries, and they are actually quite frequent, and they are sometimes cause very long-term adverse impact. And this is something that the Ministry of Health knows, because their own research team that they hired to analyze the reports that they get to their own system, reported back to them that this is the situation, that there are long-term side effects, that these side effects have causal relationship to the vaccines. And this is really a broad range of side effects. Neurological side effects, muscular side effects, menses irregularities, heart inflammation, of course. And it's important to recognize that, because for at least 2 reasons. The first of which is that we need to invest in resources in understanding how do we take care of these people, right? Like these injured people. We need
Absolutely.
We need to understand what are the mechanisms, how we actually provide care for these people. But at an even more fundamental level, and this is going back to public trust, the only rationale or one of the most important principles that will allow you to have successful vaccination programs is if people know that if they get injured, they're going to be taken care of.
Right.
Because otherwise,
why else would they trust you?
Why would I trust you, and why would I take the risk? So, in some sense, I would argue that the more pro-vaccine you are, you should be even more disturbed by the fact that the Israeli government, the Israeli Ministry of Health, suppress now very aggressively any discussion about vaccine injuries, because this is a sure way to completely undermine and destroy public trust in public health policies. And to me, that could be a disaster, because personally, as a scientist, I believe that medicine and science have a major role to play in making the well-being and the life of people better and save lives. But you cannot leverage science and medicine if you don't have the trust. And if you destroy the trust by being non-transparent, by being with no empathy, by being maybe often a source of misinformation, then that's a sure way to destroy the very basic foundation for everything.
So, similar to the Great Barrington Declaration in the United States, HALT in Israel, the CDC in the United States, the Ministry of Health in Israel, I mean, the trust is gone. It's really destroyed, like you said, as can be seen by the numbers. I'm curious if you know of what traditional vaccine numbers have been like in Israel over the last year or so.
I think that there are reports of decrease in the adherence to the traditional vaccines as well. And I'm not surprised by that.
I'm not surprised, and it's a direct result of the lack of trust that you were discussing.
Yeah, of course, the Ministry of Health is trying to point out that people like me and my colleagues that speak about the truth about the mRNA COVID-19 vaccines and they are the reason why people are hesitant to take vaccines in general. I think this is just like very, very lame excuse. The Ministry of Health, you have to understand, the Ministry of Health had full control and support of the media in Israel, unlike the US, where at least a few media outlets are willing to talk about dissenting views than the narrative. In Israel, this was a complete control that the Ministry of Health had in the media. It had complete adherence from the public to start with. They lost it. They should look in the mirror to something that the Ministry of Health put in the public domain. So let me just give the background. We actually pushed the Ministry of Health for many, many months now to release data about all-cause mortality in Israel, broken down by age groups and vaccination status. Why is that important? Because in Israel, like many other countries that are highly vaccinated, what you've seen over the last 2 years, that in spite of high rates of vaccinations, or maybe because of high rates of vaccinations, you see a dramatic increase in the excess mortality. What is the excess mortality? It's the number of expected deaths from all possible causes compared to the observed deaths. And essentially in Israel, we've seen both in 2021 and then in 2022, an increase of the excess death. So it's not only that the excess death is present, positive excess death, it seems to actually increase. And it's actually very, very rare that you're going to see 3 years in a row, 2020, 2021, and 2022, having increased excess mortality, because the intuition should be that the people that tend to die are a certain age group, the older people, unfortunately. And if you had a bad year this year, the pool of people that can die next year is smaller, so you should actually not likely to see something a little bit better next year. But here we see 3 years of consecutive positive excess mortality that is actually on the rise. Now, the Ministry of Health refused to actually release this data, and in spite of us, we have to sue the Ministry of Health at court, and the court actually provided a court order that the Ministry of Health is obliged to provide this data, but nevertheless, the Ministry of Health is finding still different excuses not to provide this data to the public. But several months ago, the Ministry of Health declared that they're going to do their own study, and that was published in all the major media outlets in Israel. But then very recently, very quietly, they posted their report, and there is a reason why they are very quiet about this. So let's just go back maybe to the picture that you showed. This is taken from their research and a study, if I may call it that way. And the study is based on an approach that is called negative controls or self-control, that basically is comparing vaccinated people to themselves. Okay, and what does it mean? They take everybody, for example, in this case, that received the second dose, and they start to follow them over 2 periods of time. The first 30 days, that's the first period here, and then the next 30 days. Okay, and the Ministry of Health basically is reporting here based on how many days passed from the second dose of the vaccine, how many people died, right? And you actually can see here the 2 periods of time. This is unfortunately, and in a way that it's very hard to explain, does not include deaths that were registered because of corona. This is just all other reasons, not including corona. Now, the Ministry of Health, looking at this, is trying to calm everybody down and say, oh, there is no problem here, because immediately after the vaccine, where you are more likely to die because of the vaccine, there are fewer deaths, actually substantially fewer deaths, 540 versus the 1,075 in the second period. You can actually see this the pattern here on the right-hand side. Now, this is actually highly misleading, because a much more scientific interpretation of this data is that there is actually a dramatic increase in the risk of dying starting about 4 weeks after you receive the vaccine, which can actually perfectly fit to some of the known mechanisms of autoimmune reactions that can actually happen over time. In fact, when you look at it very carefully, there is also a small bump in the 4 to 7 days immediately after the second dose. If you can sort of see this going up a little bit and then going down, and then in a matter of 2 weeks, it's almost tripling itself, right? This cannot be a coincidence, and the explanation that the Ministry of Health gave to this picture was something that is called healthy vaccinee effect, which is essentially saying, hey, people that got vaccinated only because they were healthy enough to get vaccinated. Therefore, you should expect immediately after vaccination much lower death rate, and that's what explains this picture. So we cannot conclude anything. But when you look on the true definition of healthy vaccinee effect, it's actually not comparing the same group to itself like we have here, but rather than comparing the vaccinated to the unvaccinated, which they never provided in this study. But also, when you look at the pattern after other vaccines, you should have seen a completely different pattern than what we see here. And this dramatic increase, again, look on day 30, 33, 35, and then look on 10 days later, right? Going to the right, the death rate is skyrocketing. So I think that this is just like, again, the Ministry of Health putting out their data that is very concerning, but then speaks about this in a very misleading way. By the way, doing a lot of effort that this is not going to be very visible to the public in Israel. No media outlet reported on this. They put it at the beginning behind the paywall, but now it's on their website. They don't advertise this. And I think there is a very good reason why they don't advertise this. And when I put this together with them not revealing the data, not giving access to the data, and also holding back a lot of important data here. For example, how many deaths from corona there were, and what was the death rate after the first dose of the vaccine. They never report on that, and that's actually very concerning. So when I look at this, I think that one should, I think this is a very concerning graph that, in all likelihood, should make you very, very concerned, and it really calls for very, very thorough investigation by I think independent researchers that need to kind of understand what is going on. In fact, in their study, they also have some potentially concerning signals about cardiovascular events among young people, which is, again, might be consistent with what we talked about before when we talked about the increase in cardiovascular EMS calls and cardiac arrest EMS calls in Israel in the first half of 2021, parallel to the launch of the vaccination campaign in Israel. So again, I think that unfortunately the Minister of Health in Israel is a bad example of a regulatory authority that really behaves in a way that is non-transparent, non-scientific, and also sort of raises the question whether their goal is really to make sure that we have the best public health policy for the well-being of the people in Israel, or are we in the business now of protecting their narrative that these vaccines are safe and effective? And I think when you look on a picture like that and how they explain it, and the lack of transparency with data, you are quite disturbed by their approach to these very critical issues. Actually in Israel was actually proud of the fact that they aggressively vaccinated all the nursing homes very early on in the vaccination campaign, which actually goes also against this story about the healthy vaccine effect, because the most vulnerable people are usually
in the nursing homes
that stay in nursing homes. So I think there are many reasons why their explanation is actually quite shaky, to say the least.
Well, they're not alone in being a regulatory agency that's not looking out for their citizens. Although there do seem to be some European countries that are speaking up. I don't know. Do you see what the German health minister said this week? That's a straight up admission of 1 out of 10,000, and we know the real number is a lot higher than that. But
that's reporting 1 in 10,000 doses.
Oh yeah.
Right? So it's 1 in 10,000 doses. If you receive 4 doses, that's essentially 1 in 2,500. And this is just the reporting rate that we know always is a major underreporting factor. So, and these are just the serious. These are just the serious. And people need to understand, serious adverse event involves usually a death, hospitalization, or life-changing event, like a long-term disability. These are like we call serious adverse events. Really, they are really serious. We have to actually acknowledge that. So, but again, I think that it's very, very important that as societies, as scientists, and as regulatory authorities, we should invest in research and in clinical efforts to develop both the ability to understand better what are the harm mechanisms of the mRNA vaccines, the other vaccines, and equally important, develop treatments that would make sure that the health impact is minimal. And I think we are obliged to do that, both ethically, but also from a practical perspective. We don't want to have having a lot of sick people or unhealthy people in a society has a dramatic impact on many aspects of life.
Right. Well, thank you so much. I really appreciate your explanation of all of that. It was really interesting, a little terrifying, and keep up your good work and the good fight. And thank you so much.
Thank you.